In this upcoming interview with Dr. Jason Fung, you are going to hear and see a side of Dr. Jason Fung you've never seen before. He shares what happened when he had to change his entire practice when he discovered all about intermittent fasting, eating a low carbohydrate diet, high fat diet, and what happened, the repercussions from that. He's going to share powerful stories about type 2 diabetics who have been on insulin for several years, who have gone off the insulin in just a month and a half. This conversation was one of my favorites that I've ever had. Dr. Fung is a legend in the keto, the fasting, and just the health space. So you're gonna love this interview. I'm so excited to share him with you, to share the amazing Dr. Fung. And before I do, just wanna let you know that we have extensive notes for the Keto Kamp podcast, and you can find all those notes down below on this video. So take advantage of the links, of the resources, all the information you see down below, and share this video with a friend. It's gonna make a big difference in their lives. This episode is sponsored by Purity Coffee, the world's healthiest keto coffee beans, high in antioxidants, mold-free. They have a lot of research and they back up their claims. Go to ketokampcoffee.com and I'll put a link down below. Get your Purity Coffee beans today. So let's get into this incredible interview with Dr. Jason Fung. Dr. Jason Fung, thank you so much for coming on the Keto Kamp podcast.
Oh, thanks for having me. Great to be here.
I'm excited to share with you. My audience already knows you, but I'm excited to chat with you and have an amazing conversation to impact many lives. I want to hear about how you got into the health space. At what point of your life did you decide that you wanted to become a doctor, or you wanted to make a difference with people, working with them on their health?
I guess, I actually thought coming out of high school that I might go into engineering, because I was sort of this math science person. And then sort of somewhere along the line, just before I made my final decision in going to university, I kind of thought, what I would like to do. And it was really an equal heat between being a physician, which is what I had kind of always thought. My parents sort of encouraged that, or being an engineer. And I really wanted to work on big jet engines. That's really what I wanted to do. It was very close, I have to say. But in the end, I decided to be a physician. I'm not really even sure what tipped the balance. I can't even say, because I did interview, when you're deciding for university, I did interview for engineering very closely. And but yeah, in the end, I thought, okay, being a physician's probably what is sort of more suited to my style. And then even for a couple of years in university, I thought maybe I'd like to do research, because I like new things and I like to think about things. And is it really being a physician, or how about helping people by doing research? So again, it was also after 2 years, I applied to medical school, and it's sort of an even heat between going and just doing pure research and becoming a physician. And again, it was sort of like a dead heat. But in the end, I decided if I was a physician, I could still do research. So it's, that way I could do both and not limit myself. So that's sort of where things came about. But you never know where things end up. But I'm happy where I am. So.
Well, I can tell you this: millions of people are happy that you chose the medical route, because if you were designing jet engines, yeah, that would be cool and all, but you wouldn't have impacted the lives that you're impacting. So thank God you chose the medical route, because you're making a big difference. It's so cool to look back and see how you just connect the dots and how just one decision just impacts your life and so many others. So you decided on medical school. What made you decide on nephrology, on the kidneys, on kidney disease? What made you go in that direction?
So, even in medical school, there's all sort of different types of doctors, and certain specialties appeal to different types of doctors. So a lot of the sort of sporty types, they go into orthopedics and sports medicine. A lot of the, the nurturing types, they go into like pediatrics. And so the people sort of divide themselves according to their certain personalities within medicine. Nephrology is sort of a very a specialty where you think a lot about stuff. That is, there's a lot of complex things to do with dialysis and electrolytes and so on. And it's something that you generally have to think a lot about. But it's not like an action specialty like cardiology, where you just go in there and you throw in a stent, and or surgery, where you go in and cut somebody's, appendix out. So it's sort of, it suited my personality better. And that's really why I really gravitated towards nephrology, just because it's sort of a thinking person sort of specialty. Internal medicine, which is all the internal organs, including, say, the heart and the kidneys and the liver, all of those are sort of part of internal medicine, which is sort of this more thinking specialty rather than the other. So I like that. It appealed to me. It suited my personality.
Awesome. And right now you're known for being a big advocate of a low carb diet, intermittent fasting. At what point of your career did you start to realize that things were not working the way you wanted to work? And what shifted you in this direction of fasting and low carb prior to how you worked on your patients before? What happened in your career?
So what happened was that we saw, kidney disease, the most important cause of kidney disease, really by far, is type 2 diabetes, which is obviously very closely related to weight gain and obesity. So the way I was taught, and everybody is taught, we learn all about medication, surgeries, procedures like dialysis, but you don't learn a lot about nutrition. So I really had no interest in any of that. It really wasn't considered part of the sort of medical specialty. It's sort of like, that's what dietitians do. It's not what doctors do, sort of idea. And I thought like that for a long time as well. And it came to about sort of probably around 2010-ish that I really started to think that this is actually quite wrong, because everybody knows that if you are overweight, you get type 2 diabetes, which gives you kidney disease. To treat the kidney disease with medications at that point is really the least effective way to treat people, because the entire process. Therefore, if people don't gain weight, they don't get type 2 diabetes and they never get kidney disease, as opposed to treating the kidney disease at the end with some medications, which are of variable use, and then eventually holding their hand as they go on dialysis. So it was very unsatisfying to me to know that there's a disease that is sort of preventable, but I wasn't doing anything to prevent it. I was just seeing them when they got their kidney disease and then said, oh, here's some medication for you. And that's not what I signed up for. I'm there to make people better. So therefore, that's where I really, really sort of became very interested in the question of how do you lose weight? What causes weight gain? And the real question was, to me, and I thought about it in a very medical sense, is what causes weight gain? Because that's the way you approach things. So if it's your appendix that's giving you problems, you need to know what the cause is so you can treat it. You don't just say, well, you have pain in your tummy, here's some Tylenol. That's not the right approach, because you haven't taken care of the actual issue. So you have to really look at what the root cause of the disease is. And that's really what you should be doing in order to be successful. So then that's when I really, really started to look at the question of what causes weight gain. And I think that's a question that not a lot of people ever thought about, because we all thought it was pretty obvious. Well, too many calories, calories in, calories out. And as I looked into it further, I realized that the whole calories sort of story is just not scientific at all. It's terrible. It's like the whole thing is all wrong for a lot of reasons. That was the first sort of moment I thought, well, this is sort of strange, because everything I thought I knew, everything I've been taught in terms of weight gain and obesity, which is so important for so many of these diseases, is actually completely and utterly incorrect. You can go back and you can look and you can say, okay, well, are there any randomized control trials, which is sort of the gold standard of medical evidence, that calorie reduced diets will help you lose weight? And like, no, there's not. Is there any, practical experience? I was like, yes, literally billions of people have done calorie reduced diets, and like virtually none of them lose weight. So it's not like it was super successful. It was like super unsuccessful. And yet I, as a physician, was pushing these calorie reduced diets because that's all I knew. And I thought, okay, well, that's got to change. So that's really where I started to think about it and really, go back to sort of basics and say, what is causing weight gain and so on. And that's sort of what led to the obesity code, which is talking about really what the underlying cause of weight gain is. Then I came to the second question, which is that once you realize, okay, what causes weight gain? And, for a lot of people, it's really hyperinsulinemia or too much insulin in the body. Then you come to the second question, which is very important in terms of treatment, in terms of what are you going to do about it? So there's several strategies to reduce insulin, obviously. So we were focused on calories when we should have been focused on sort of the hormone insulin. So you can lower it with carbohydrate-reduced diet. So that is successful up to a certain point. But then I thought, well, I tried it for a lot of patients, and, some were successful, some were not successful. But then I thought, well, there's got to be like a better way to do this, because, obesity in the 1970s is virtually non-existent, and now it's sort of like 70% of the American adult population. So that's when I started to think about fasting. And of course, the first thing I thought was, wow, that's a really, really bad idea. And it was the same process. I was thinking like, okay, well, wait a second here. I think it's a bad idea, because that's what everybody tells me. Oh, you're going to go into starvation mode, and you're going to be so hungry. You're going to be forced to stuff donuts in your mouth. But then I thought, okay, well, let's think about this for a second, and let's look at what the medical literature actually says about fasting. And again, the same thing is like, it was completely the opposite of what I thought I knew, which is fascinating and a huge opportunity, because, hey, if here's a strategy that has been used for thousands of years and nobody's using it, then I can use it and make people better. And what was interesting was that as I started to introduce some of this stuff to patients, and because, that's what I do, I see patients, some of the stories were just incredible. Like, and we published a couple of these. We published a case series on a couple of these. And essentially people with 20 plus years of type 2 diabetes, it was like gone in like, a month and a half sort of thing. And these were patients I was treating. I'm like, whoa, I just treated you wrong for the last 10 years because I just took away the whole thing just by changing your diet. And it's not easy. So, I don't want people to get the impression that, oh, hey, just make this quick switch and it's, all sunshine and unicorns. It's tough, and you got to stick to it. You got to work at it. Fasting's less fun than, say, eating pizza and donuts. So you have to really give people the support and the education that they need. And a lot of people were dead set against it because their doctors would tell them, hey, that's the worst thing you could do. And in fact, just this morning I saw a patient and they said the same thing. I had told them, hey, you should do some fasting. They went to talk to their physician and their dietitian. And then he came back to me and said, I haven't done it because they told me it's the worst thing I could possibly do for my type 2 diabetes. I'm like, well, you can do whatever you like, but his A1C was like 10. So it's like he wasn't doing great on the standard diet. So that's sort of how things came about, that I really became really interested in sort of both weight loss and intermittent fasting as a treatment, because low-carb diets have been around for a long, long time. They've been around since Atkins and successful to a certain degree. And of course, had been really coming back in terms of ketogenic diets, which was slightly different than sort of, and even paleo diets, sort of variations on Atkins style diets. But nobody had really been talking about intermittent fasting, especially like 5-6 years ago when I really started talking about this. Nobody was talking about intermittent fasting. And it's sort of, when you think about it, it's actually the most obvious thing that you can do.
Yeah, and nobody was talking about it. Now it's one of the most searched terms on Dr. Google, and you're a big part of that. It is obvious, right? When you don't eat, you lose weight. You eat, you gain weight. You insulin goes up, you store fat. It makes a lot of sense. And I want to know, why are there so many sophisticated people out there who have PhDs, and I'm not going to name names, but they're very smart people who say that if you want to lose weight, you just got to cut your calories and exercise more. It's all an energy expenditure hypothesis to lose weight. Why are they still saying this to this day?
I think it's because it's very difficult if you've built sort of a career based on calories. And you got to realize that there's a lot of people that are very interested in keeping the focus on calories, because and they got busted a few years ago. So Coca-Cola, for example, had been funding the University of Colorado to promote this global energy balance consortium or something like that. And it was profiled in the New York Times, because what Coca-Cola wanted to do, of course, was to keep people focused on calories, so that they could say, well, if you eat 100 calories of broccoli, it's as fattening as 100 calories of Coca-Cola, which of course is completely not true. Like, who gets fat eating broccoli? Like, just about nobody. So, but they wanted to make that sort of equivalent so that you don't think that there's anything particularly wrong with that sugary soda that you're about to drink, and it's very profitable for them. So they have a vested interest in keeping the focus on calories because, of course, they are peddling sugary drinks, which is sort of the opposite of what I and most other people who are reasonably intelligent about nutrition say. There's a bunch of calorie like diehards who are like, oh no, cookies and salmon are the same if they're the same calories. I'm like, you guys are idiots, because the minute you put those foods in your mouth, the hormonal response is completely and utterly different. That is, if you eat cookies, your insulin spikes way up. If you eat salmon or an egg or an avocado, same calories, totally different hormonal response. Insulin goes, goes nowhere, but peptide YY, which is a satiety hormone, or cholecystokinin, which is a satiety hormone, they go up. So it's a totally different response of your body to different foods. And that's obvious. We can measure that. There's no reason you can't measure that. But for some reason, people still say, oh, no, it's about calories. So the thing is that if you're brought up with this idea that it's calories, if you've written a bunch of papers that it's about calories, it's all about calories, ketogenic diets work because they restrict calories. I'm like, whatever you say, right? It's like, you can argue that the point is that it's very convenient for certain food companies and beverage companies to keep that focus, because then you can do two things. You can equate all foods, so that all of a sudden your sugary soda is no worse than anything else. And you can equate diet and exercise, because diet and exercise are totally different things. Diet is what you eat. It affects the liver mostly. Exercise is mostly about skeletal muscle. They're totally different. There's nothing the same about them. But through the magic of calories, you can say, well, if you walk 100 minutes, you'll burn off X amount of calories, which means you could eat, this many cookies. There's nothing the same about them, because again, they're completely different physiologic pathways, and calories is not a physiologic term. There's no calorie receptors in our body. Our body doesn't respond to calories. Our body responds to proteins, fats, and carbohydrates. That's what it does. It doesn't care about calories in any way. So you can't equate them, because again, you can't exercise your liver, for example. So you eat a lot of cookies, for example, your liver is going to store fat. Your insulin's going to go way up. You're going to store a lot of glycogen. If you store too much, then you wind up making fat with de novo lipogenesis. Well, how does exercise impact that? Not at all. So you're going to be healthier in that you're going to be stronger, but you're going to still have a fatty liver and develop type 2 diabetes. So exercise and diet are completely separate things, but calories makes them the same. And that's why Coca-Cola was so interested to make, all of a sudden, this obesity crisis is not a crisis of, hey, you're drinking too much Coca-Cola. It's a crisis of, hey, you should have got off your butt and exercise, which is like, okay, now you've just changed the whole story of what the problem was. And if you don't know the problem, you can't fix it, because if you think that you can eat cookies and drink Coke and then exercise and you'll be healthy, you're wrong. But Coca-Cola wants you to be right. So they spent so much money. Like, there's physicians, for example, at the University of Toronto, where I am, and they've written in the newspaper and they've written papers about how fructose and sugar is almost a health food. I'm like, okay, you've got to be kidding me. Like, how can you think it's almost a health food? It's ridiculous. But yet he goes and writes papers. Then you look at his conflicts of interest, and he's paid by Coca-Cola, and he's been sent all over the world by Coca-Cola and all this sort of stuff. He gets into the newspaper because Coca-Cola, buys a lot of influence. So it's sort of like, that's why there's so much interest in keeping this whole calorie story. But it's sort of there's a lot of conflicts there.
Yeah, I agree with you. It's a huge distraction to what really matters. And you just broke down what really matters. It's the hormonal response, the metabolic response from those calories. You could have gone down that path because you had a decision. You built your career mostly in the conventional world, what you just spoke about. And then you came across research. You figured out, you found out that it was not working for you. And then you had a decision to make. You had a decision to explore the ketogenic diet, a low carb diet, and intermittent fasting, or stick to your guns and do what you built your career doing. So what was it for you? Because you made that switch, and that must have been so difficult. And I'm sure some of your peers, you got some backlash. So I'd love for you to share how difficult that transition was for you, and what kind of backlash did you receive at that point of your career?
Yeah, so there was a huge backlash, especially to sort of like low carb diets were around, so people knew about them, but nobody wanted to hear about ketogenic diets, which were sort of much higher in fat than the usual, and fasting, of course, nobody wanted to hear about. And the thing is that it's so much easier just to sort of say, oh well, I guess there are experts, and this is what most people say. It's like, well, they're experts in nutrition, and they say it's all about calories, and also my local university affiliated endocrinologist or whatever says it's all about calories, so they must be right. But, to me, again, it goes back to it didn't really satisfy me in terms of searching for what was really true, because it made no sense at all. And so, if you're not that interested in it, then you'd probably just leave it. You'd say, whatever, there's a minor mystery here, but I'm just going to go off because I'm busy and my kids have hockey and whatever, right? But that's not sort of the way I am. I sort of get really interested, like obsessed with these questions. And when things don't sort of match up, that interests me sort of intensely from a sort of scientific standpoint. I mean, that's why that's why I was so interested in like research, for example, because there are these sort of puzzles that need to be figured out. And that's really what I was trying to get. And it's like, that's why I really made that switch. So because I was so interested in this question, this sort of scientific puzzle, because it impacted so many people. But on the other hand, I just get sort of that way, in that I don't like it when things don't make sense to me. And when I see its glaring omission, I want to get to the bottom of it. So that's sort of why. And then, so as I started to talk about it, it's the same thing. It's really difficult at first, because really I was out there mostly on my own. And of course, there were some other people talking about it, but not specifically about fasting. But there was a few people that were very interested in that. So like Andreas of Diet Doctor and Professor Tim Noakes and sort of thing. There was a number of people. Gary Taubes obviously had talked about this, although not exactly in the same manner, but he talked about this sort of conundrum as well for many years. So but as you talk about it, there's a lot of people who don't want to hear it because they're not that interested. To them, it's just sort of this minor problem, and let's just go with what everybody else says. And I'm this voice that's saying no. So of course there's a lot of backlash, but then sort of funny thing happened, because patients were getting better when they were doing the fasting. And at the end of the day, you can't ignore that, because this is what we do. This is my job, is to make people better. And so the thing is that other doctors had noticed. So within my area, like a lot of family physicians and so on, they would see, oh, hey, there's this patient that I had with 20 years of type 2 diabetes that just went away. They lost weight. They got off all their medications, and they're super happy. And to other physicians, that's sort of proof, like in the flesh, and you can't ignore that. So that's where it became very, very hard to deny that this is a reasonable alternative for people. I'm not saying that everybody has to do it, but it's a reasonable alternative for people to use. And so that's sort of where it all started. And then I wrote, the books to really sort of explain it to people. And everybody, and I think that the obesity code is really about that sort of explaining how it all comes about. And everybody thinks that it's like a lay book because it's published, as a book, but it's like, most doctors don't know any of the information in that. And I always think in my mind that this is actually a book that I want physicians to read. It's great if lay people read them and understand it, but this is what I actually think physicians need to understand. And then the Complete Guide to Fasting is more of a sort of a practical guide that can really help people. So it's a bit different focus.
Yeah, and I have both of those right here. And if you haven't read it, definitely, if you're watching this on YouTube, you could see the books, get them. All of his books are incredible. I love that mission of yours right there, for every doctor to have the obesity code. Jason, a few years ago, well, for most of my life, my parents immigrated from Iran back in the 70s, and they had my sister and then me, and I was born here in Miami. My father developed type 2 diabetes when I was a young kid, and I remember him struggling with it his whole life. And I didn't really understand the disease most of my life. And every year I just saw his health deteriorate. And it was about 6 years ago. I would take him to his doctor's appointments every month. I would fill up his medication. I would get the dietary advice from his doctors, and they would tell me to buy him, like sugar-free Gatorade and Fiber One bars, and he could eat a lot of fruit and stay away from fat. And I followed that advice. I trusted the doctor's advice. And 6 years ago, he suffered a massive stroke from the diabetes, and he lost the ability to speak. He lost complete right side function, and he was essentially on his deathbed for 9 months. And I watched his life just leave his body every time I went to go visit him. And it was a very difficult time in my life. And it was 5 years ago. It was actually August 12th, 2014. So 2 days ago, where I went to go visit him, and he was in the worst shape. And he ended up passing away the day after I visited him that night. And ever since that happened, I set out to study diabetes, to study what's going on with this epidemic. And so many people have this disease, and why the advice that I trusted didn't work. The advice that they gave me didn't work. And I've come to the conclusion, after reading your books, after reading so much great books out there, that the information that I now know, the information that you share, would have saved his life. He'd still be here today if I had this information. And I also understand that I was given that mountain so I could show the world that this mountain can be moved. So I am 100% on board with your mission. And just going through that situation with my dad, I know there's so many people out there that are going through that right now. And there are so many people that are going to hear this. This is what makes me happy. They're going to hear this interview, and they don't have to go through that. They're going to start becoming a genius and not just an intellectual. Like Albert Einstein said, intellectuals solve problems, geniuses prevent them. They're actually going to be proactive. So I'm so excited about this interview, and I wanted to share that with you because I felt like it's really relevant to what you do. And I want to say thank you for your work.
Absolutely. And that was really my hope, is that people would be able to, take that information and have a practical sort of intervention and be able to prevent really diabetes, type 2 diabetes, because it's a reversible disease. And there's a couple of, the whole calories thing, it bothers me. But it bothered me even more because I think that the standard treatment of all type 2 diabetics for many, many, many years, and I did it for years, right, for 15 years. So I understand where these doctors are coming from. They really didn't know any better. This is what we were taught. And we thought that we could trust these university professors and so on. But I also came to the conclusion that most treatment for type 2 diabetes is completely and utterly incorrect. Like, we focus on the wrong thing. We focus on getting the sugar down by giving medications, when we should have been focusing on the diet to make people lose weight, because if you lose weight, your diabetes gets better. And for some reason, that just never percolated down to the diabetes specialist. For them, they want to give more medications, especially insulin, which is notorious for causing weight gain. And it's like the whole thing is completely illogical, in that you have a disease of type 2 diabetes. And this is what I go over, and this is the reason I wrote the diabetes code, which is sort of very specific to type 2 diabetes and how to prevent and reverse it. Because that's actually much closer to me, because that's what I see every day. I was tired of seeing it. And I still get sad when I see a type 2 diabetic that I have to put on dialysis, or they get their foot chopped off, because I think the same thing. If I had gone to you 10 years ago, I could have prevented all of this. And the thing is that what doesn't make any sense is that really we know that people with type 2 diabetes, the whole disease is that they have too much sugar in their body. So the question is, what does a medication like insulin or something like that do? Does it get rid of the sugar? If it doesn't, it's not actually doing you any good. And that's the problem. And we had the studies to prove that 10 years ago, that just giving more medications for type 2 diabetes is not effective at preventing complications, that is heart attacks, strokes, cancer, kidney disease, blindness, that kind of thing. And so here it is. Here we had again this super important disease in the United States and Canada, and I was thinking that everything about it was being treated completely and utterly incorrectly. And that's really where this came from. That's why I wrote very shortly after. To me, it's sort of the same thing, obesity and type 2 diabetes, because they're very closely linked. But that was what the diabetes code was about. To let people understand, again, this is what the disease is, and this is how to treat it, and you can reverse it if you stick to it. And that's what I hope too, that people that you wouldn't have, like your dad, wouldn't have to do this in the future if we let enough people know. And hopefully hopefully we make it, we move the needle somewhere.
Yeah, and we definitely are. So if somebody's listening to this right now and they have type 2 diabetes, or a family member has it, and they're taking insulin and the blood sugar is going down, where is the sugar going? If it's showing that on their glucose meter, it's going down, where is the sugar actually going?
Yeah, people don't think about it like that, but it's super, super logical, because it's like, okay, if body is not getting rid of the sugar, where did it go? Because the blood sugar went down, the sugar went into the liver, got turned into fat, and gained weight. And as you gain weight, everybody knows that type 2 diabetes is going to get worse. So it's like, okay, you're taking a medication that is eventually making your type 2 diabetes worse. Like, that's not the right thing to do. Like, you're supposed to be making it better. And that's the point. But you can use this sort of free, natural intervention like intermittent fasting to say, well, if your blood sugar is going down because you're fasting, where'd it go? Well, it all got burnt off for energy. That's where it went. We know where it went. So it's like, it's so much more logical to treat it in this way. And it explains so much about the disease, because why is there so much type 2 diabetes now and there wasn't 20, 30, 40 years ago? And you ask regular physicians, they'll say, I don't know, people are taking too many calories. I'm like, okay, show me your physiologic pathway of how calories leads to type 2 diabetes. Like, please, like, show me any physiologic pathway, because we're supposed to be so science-based in medicine, where calories even comes in. Because the calorie of a fat, protein, and carbohydrate are totally different. They're metabolized differently. They have different metabolic fates. Protein, for example, is not a store of energy. It's used to build protein. So, if you take too much, of course it does. But there's other pathways, right? There's mTOR. There's other pathways that get activated, AMPK. We know all this stuff. But where's calories? We don't see it anywhere. And yet somehow it's the root of all our problems. It's like this sort of phantom menace that's around, that we want to blame everything on this sort of phantom menace. And it's like, it's not the right thing, because then you take your eyes off the ball, right? Because if you're thinking all about calories, then you think you can drink diet sodas all day and be fine. Well, I'll tell you, I know tons of people who drank diet sodas all day, didn't lose any weight. They did much worse.
Yeah, it's a distraction. It's a complete distraction. So how many people have gone through your clinic, the IDM program, and have you put on a fasting protocol? Do you have an estimation?
It's several thousand at least. It's quite a few. So we've changed it. So we used to just run it. And the reason we have so many is that, again, something that was different that we did. So Megan Ramos is who works with me very closely for the last sort of 10 years.
She's amazing, by the way.
Yeah, she's an amazing educator. And so she actually almost went to medical school too, but then wound up doing this because she thought was more life-changing. But the thing is that we when I started, I took a medical approach to it. So instead of saying, okay, well, here's somebody who's fasting, and there have been fasting clinics in Germany, for example, and you pay 3,000 euros and you go for a week and you fast. Well, you're not going to get many people doing it for 3,000 euros for a week. But I took a sort of more approach because I'm a physician. The way I approach it is that a patient comes to see me, and 10 minutes later, I tell them what they need to do. Sometimes I give them a prescription or whatever, and then I book a follow-up appointment. And I see people I see a lot of people every day. So I did the same thing with the fasting. It's not something that I'll spend like weeks on one person with. It's like you come in, I tell you what you need to do. And then 10 minutes later, I see the next person and tell them what to do. So I'm seeing 20, 30 people a day, 5 days a week, year after year. The numbers just sort of add up. So it's been at least several thousand people that we've treated. I mean, now we're trying to sort of expand it a bit so that we have more, make this approach sort of available online so that it's not sort of local within my area in Toronto, that we can help people sort of all over. So it's thousands of people. And, some of the stories are just, they're so, they make me so happy, because it's like, somebody will read it or listen to a podcast and then just start doing it because it's their own decision. And then they get off their medications and their doctors are flabbergasted. They don't know what's happened. They're losing weight. They're off their medications. They're super healthy. Their blood work has come back to normal. And it's something that people, I've been able to help them take control of their own health, which is incredible, because type 2 diabetes before, and your dad would be like, you go to the doctor, you get another prescription, or you get more insulin, and then you go home. And it's like, what do you do about it? Well, nothing. Eat low-fat diet. That's all you can do about it. And you ate low-fat diet until, everything tasted like cardboard, and you still didn't get better. And this was the problem. But here's something that they could do themselves to actually make themselves better. And it's not some sort of fad, because I saw this the other day. Oh, it's a fad. I'm like, right, the fad that's been around for like 5,000 years, right? That's a hell of a fad. I mean, they talked about it in the Bible. Every year around Easter, around Lent, we talk about fasting every single year for the last 10 years. Actually, I probably didn't pay attention much, but in the last 5 years for sure.
Yeah, it's definitely not a fad. It's a fact. Yeah, it's been around since the dawn of humankind.
Long. So as I said, it's like since the beginning of at least, Catholicism in the year zero sort of thing, because we're in the year 2019. So, okay, minimum 2019 years where people have talked about fasting. And they didn't talk about it as some sort of terrible thing. They talked about it in terms of, purification and cleansing and all this sort of virtuous sort of thing. So it's like, yeah, it's a 2,000-year-old fad, and here you are talking about it as if we just came up with it. Like, I didn't come up with it. I mean, I just talked about it because it was logical to me. So sometimes you see this once in a while, but at least it's being talked about, which is totally different than 5 years ago. Like, nobody talked about it because it wasn't done. So now at least you get that out there. And I think it's because people are listening because it's so logical. It makes a lot of sense. And people are starting to know other people who have had sort of incredible success, and they want to replicate that success. And that's great, because it's a snowball effect, because as one person sees their friend getting healthier or coming off their medication or losing weight, they want to know, what did you do? And they'll say, well, I tried this. And then and these people, I always feel for them. They're like, I've tried every diet in the book, and here's a new thing that they hadn't heard of. So it's like, oh, okay, well, maybe it's going to work. And sometimes they try it, and sometimes it works. And, it's a great feeling to be privileged to that.
Absolutely. And social media is a huge reason why, like podcasts like this, they're able to spread like wildfire. And we have a few minutes left. I have 3 quick questions. Before I get to those 3 quick questions, a lot of the backlash I get from when I give lectures on health, that I always talk about fasting. And I always ask the question in the audience, and I ask them, what do you think is the Guinness World Record for the longest recorded fast? And I hear, 7 days, 21 days, maybe 40 or 60. But it doesn't go any much more than that. What is the Guinness World Record for the world's longest recorded fast?
Like 382 days. This is like ridiculously long. And it was monitored, and, and they wrote it up in a medical journal and so on. And it's quite amazing how long you can go without food. And the guy apparently had felt well through that entire thing. They wrote up the whole case history, and he felt great, and didn't feel sick or anything. Because you hear all these things about fasting. Oh, you're going to be weak. You're not going to be able to concentrate. And it's just strange that the truth is almost exactly the opposite of that. Most people feel so much better and feel more energy and more concentration and better abilities. And, to me, the most important thing is, that people feel well through that entire thing. So that's an incredible thing. And it gives people a sense like, hey, the other way to think of it, is that if not going with food for one day is not a big deal if the world record is 382 days. But the other thing to think about is, in a year, for 365 days a year and 3 meals a day, you're talking about 1,000 meals a day. Even if you do a 7-day fast, you're going to miss 21 of your 1,000 meals. Like, how is that a big deal? Like, I just don't understand why people make such a big deal of it. And even like 3 meals. Okay, you're going to go do a 24-hour, 36-hour fast. You miss 3 meals out of 1,000 that you had that year. So if you're 50 years old, you've eaten like 50,000 meals and you've missed 3 and you think it's a big deal. It's like you think you're going to die, right? It's like, I don't think so. What do people think body fat is there for? It's there for you to use. So use it. That's the whole point.
Exactly. It's an amazing mechanism, the fact that we store fat to survive. Okay, final 3 questions, Jason. Number 1, what's the most excited thing that you're working on right now?
The most exciting thing, I think, I'm working on a book on cancer, which is a very, very interesting topic, I have to say. And it's not purely related to diet, but there is a dietary component to it. So it's not just about diet, but what we see is that there are certain diets that are related to weight. And this is actually new knowledge since about 2003-ish. We didn't know this. We thought, well, cancer is caused by mutations, cancer is caused by viruses, cancer is caused by radiation, for example. We knew those cancers. What we didn't expect to find is that if you are overweight or type 2 diabetes, your risk of certain types of cancers is way up. And that's breast cancer, colorectal cancer, pancreas, liver. So there's a couple of them. So the World Health Organization actually classifies 13 different types of cancer as obesity related. And it explores sort of what causes cancer, what the mechanisms are, because it's super exciting, because here's another disease, like a terrible disease like breast cancer, colorectal cancer, where you can do something and change your risk. Because if you can avoid, you hear me?
I hear you.
Are you okay there?
Yeah, you froze, but I hear you. Yeah.
Okay, sorry. My internet connection said it was unstable. So, but here's another disease where you can do something about it. So it's not something that you just say, oh, okay, you're going to get breast cancer or colon cancer. You can actually do something to reduce your risk, which is avoid type 2 diabetes, avoid obesity, but explore sort of the mechanisms of that.
Yeah. When do you expect that to be out?
Probably next year.
Wow, I can't wait for that. That's going to be incredible.
But it actually explores the whole story of what cancer is, because that has undergone a complete revolution in the last sort of 10 years. And I don't think anybody actually knows it. Like I talk to people and it's like, they're still talking about this sort of old thinking about cancer as this genetic mutations disease. The story has completely changed in that time, but I think it's still limited to a small number of sort of specialists that see it that way.
Yeah, I had Dr. Naisha Winters on the show earlier on this podcast, and she's explained a lot about that. So I can't wait for that book. Second question is, what are you grateful for today?
I'm grateful for a lot of things. I think that mostly I'm grateful that I've had the opportunity to make a difference to so many people, because that's sort of what I wanted to be. Like, getting back to your original question about sort of how I came into medicine. Sorry, are you there?
I hear you. You're just frozen. You could just keep talking. It's fine. Do you
Sorry,
hear me?
are you there?
Yeah, I'm here. I heard you, but you were frozen for a second.
Yeah, yours was frozen too, so I wasn't sure. But, so I'm really grateful that I've been able to help a lot of people in this way, because again, it comes back to, your original question about sort of why you went into medicine. And the reason you go into medicine is to help people. And if you are a doctor, you do have the privilege to help people, but it's limited to the people that you can see and touch and so on. And it's been great. It's a real privilege to be able to do that. But to be able to help sort of millions of people or thousands of people, it's special. It's really great to be able to do that.
Yeah, it is. And my final question for you, Jason, is what is your definition of perfect health?
I think perfect health, to me is everything, sort of working the way it's supposed to be. So there's obviously avoiding disease, which is one part of health, but then there's all those other parts of health, which is, making sure you're getting good exercise and, making sure you're eating a healthy diet, having a period of fasting kind of every day. That to me is what health is about, because maintaining sort of good, people, I always say that. So if you look at aging is sort of inevitable in one way, in that chronologically, you can't turn that sort of river of time backwards. It goes forward. But physiologically, you can actually go either way. So you can get older, you can age from a physiologic standpoint, but you can actually reverse a lot of those changes of aging with the proper diet and lifestyle, because it's not that river that moves one way. You can actually move it back the other way. And this is the same thing in terms of type 2 diabetes, for example. That's going to age you like really fast. You're going to get heart disease, you're going to get stroke, you're going to get all that. But these are all changes that increase with age, but increase even more with type 2 diabetes. But you can get rid of that type 2 diabetes. So you can actually reverse that. So you're almost sort of going backwards in time to sort of restore a lot of health. And to me, it's about trying to reverse all those changes that we can. Obviously, it's not perfect, but it's something that we can do that we didn't think that we could do sort of like 5-6 years ago. We didn't think we could reverse type 2 diabetes. We didn't think we could reverse obesity. Didn't think we could do all these things, but we can. And that's to me is very exciting.
It is. It's very empowering for the person listening right now. And I want to say, as we close off this interview, I know you got to run. Thank you so much. I want to acknowledge you for your work. Everything that I do, all the people that I educate, your fingerprints are all over that. And you said you're happy to help thousands of people, millions of people. I think before it's all said and done, there's going to be billions of people that you have helped with your work. And what you're doing out there is so valuable. Like I said, my father will still be here today if I used your work. So I want to say thank you so much for what you're doing. And if you need anything at all, know that I support you 100%, Jason. And thank you for your time today.
Thank you. Thank you so much.
Have a great day. I really hope you enjoyed that conversation with Dr. Jason Fung. Go pick up his books, go look at the resources, explore the links down below on this video. And if you haven't rated and reviewed the Keto Kamp podcast, please do so on iTunes. It makes a big difference. And like this video, if you know somebody who is obese, who has type 2 diabetes, and they're just struggling with their health, you gotta share this interview with them. You gotta share this video with your friends and your family. It'll make a big difference in their life. It'll extend their life. It'll increase their quality of life, and you will be the cause of that. So share it with a friend or two, put it on your social media. Let's get this video viral into the world, because it will make a big difference for so many people. If you're not subscribed to the Keto Kamp YouTube channel, subscribe right now, hit the bell. We're releasing brand new videos all about keto, fasting, performance, and longevity. 6 times a week you get brand new videos. Thank you so much for watching this entire video. Let me know what your biggest takeaway was down below, and you'll see me on the next video.